Okay, good morning and welcome to the October 14th, 2021 meeting of the Needham Board of Health. I'm Rob Partridge, Board Chair. This open meeting of the Board of Health is being conducted in person and remotely per the Governor's Executive Order of March 12th, 2020, and as amended on June 15th, 2021, due to the COVID-19 pandemic. The materials for this meeting have been circulated previously and are available on the town website. This meeting is being recorded and public access is available. I will introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Kathleen Brown,
Yes.
Christina Matthews,
Yes.
Steve Epstein is not here yet and not remote. And Ed Cosgrove is going to be late and Rob is here. Tim McDonald, present. Tara Gertch.
Here.
And I don't know who's remote, Tim, but I can start reading off names. Sure. Tiffany Zeich.
She is she's present. So is Taleb. I guess because we're doing Zoom, it's hard to sort of promote everyone in because then the video becomes a little bit distracted. But we do have most of the staff participating.
Okay. All right. Well, they can introduce themselves when they speak. Okay, so first on the agenda, we have a review of the minutes from our September 23rd meeting. It's a fairly long one, but I didn't have any corrections or issues.
The only thing I thought you may want to clarify is in talking about the pesticides on page 4, that last paragraph says, she requested the board to review its policies on the use of pesticides and include additional people in the process. Dr. Partridge responded, the board would so review and issue initial draft of its findings. Is that actually what we're doing?
Well, I think what we're doing is what we are going to be doing this
Next.
meeting, which is, I think we do have a review of the information in our packet for today with a lot of scientific data, information from other communities who have looked at this issue, and also a number of professional associations. I'm just trying to find the exact, you said it was page
5 of the packet, the third paragraph. Just before the discussion with serum naturals.
I mean, I guess I was just thinking draft of its findings. It almost sounds like they're going to issue some sort of research report or something. That advisory is that what we're referring to? That
I
public
think
health
that might be a
advisory?
strong way to phrase it. So maybe we could say Dr. Partridge responded that the board would review the materials, and consider its next steps or something, maybe a little bit
I
more
think that
general.
sounds right. Okay.
Yeah, I think I agree with that. Kathleen, are you okay with that?
Yeah, I also, the paragraph above it says she referenced several studies. She didn't really, she made statements about studies. So it looks just, she discussed the possible
Okay.
rather than reference several studies. She maybe provided those ahead of time. I didn't see them before the meeting.
All right, yeah, other comments or suggestions?
This is sort of odd, but in the, let's see, the next page, the first full paragraph, where it's the last sentence says, like, we're basically talking about discounts and then we somehow jump to background query checks. That sentence seems like it should be down in the discussion when we talk about what's what's different between or repetitive from the state. So we should, where we're saying things are repetitive or redundant, maybe just move it down there at the end of that. Sorry, the paragraph.
That
the full
begins.
paragraph. Yeah.
Mr. McDonald noted that there may in fact be redundant.
Yes. Yeah. Exactly. Just drop that. So that it's organized. But that's correct. Otherwise, I think.
I also wondered if we wanted to, sorry, were you done, Kathleen?
Yeah.
Okay, on page 10, 11 of the packet, under ADUs. And the second paragraph says discussion ensued on the board's support of an ADU bylaw as one means of increasing affordable housing. However, championing the cause of the citizens petition itself would not be appropriate. I wonder if there was-
Yeah, I think that's a little bit of a misunderstanding. The professional staff of the Public Health Department can engage in political activity.
Yes,
The Board of Health are politicians, elected officials, and they are free to advocate for whatever policies they believe are appropriate for the community. So I think it's a distinction between what the professional staff can do. They can help provide background information, they can educate, they can inform, but they can't say vote yes on 3 or something.
yeah. So
Um,
should we make that distinction?
Yeah.
Student staff, perhaps?
Yeah, Tara, you can get into these notes.
So that was what paragraph again?
The second paragraph under accessory dwelling units.
Okay.
The line, however, championing the cause of citizens petition itself would not be appropriate. We can sort of basically distinguish that the professional staff cannot have that role, but the Board of Health can certainly adopt any policy position it thinks is appropriate. So quite a few edits we want to make.
That's all I have.
Okay, so a vote to amend and accept the minutes.
So,
A second.
Okay, all in favor, say aye.
I,
Aye. Okay, so those are done. Okay, so first, staff reports, we'll start with environmental health. Tara.
So we had a very busy month, as you can see, once again. So a couple highlights I can review. We did have our annual food advisory board meeting. We talked about that last month, that we were going to be putting that on. Got about, eight or so people attend. Again, it was a Zoom meeting, so we were able to access more. We had 2 days that we had proposed, and half of them wanted one day, half wanted another. So it was like, oh, we couldn't find one that everyone could do. But I think overall, as long as we continue to do those once a year, get feedback, and it's very helpful from our stakeholders and how we're going forward with our food safety program and getting other ideas from them. So it's very informative. The other big highlight was the Nutritiously Needham booth that we held at the Needham Harvest Fair. So Rob and Christina came by. That was a hit. I mean, we had a lot of foot traffic that day. It was perfect weather. We had Colin from the director of the nutrition program at the Needham Public Schools there doing salsa demos. So it was really great. And we got a lot of good feedback from the public. Had a lot of brochures that we passed out. We ran out. So it's a good sign when, we got that much feedback from the public that really enjoyed that week. We did the week, that was the kickoff date, the October 3rd date, and it went through the following week. And I got a couple of requests from establishments that were taking part in that week they needed more brochures and materials. So right now, Ally is doing a summary and getting feedback that, she did a survey to see how it went, to see how we could improve, to see how we could go forward with this every year. And Colin is on board with assisting us with this every year, which is great. He wants to get out there. So we might do this every year at the Harvest Fair and have a kickoff date. So it went really well. We were happy with that.
it seemed really great. And so
Yeah.
Colin is the new director of nutrition services at the
Yes.
school, and he said he just graduated from Johnson and Wales. No, it's
Yeah,
Johnson and Wales?
yeah.
Yeah, the Culinary
Yeah.
Institute.
Yeah.
And he seems to have a real commitment to trying to use more fresh
Right.
foods and bring that into the school lunch menu, which is exciting.
So we're very happy with that. And we got really good publicity this year in the Boston
Mhm.
Globe. I mean,
I
Cindy
saw that.
was great at getting that out there for us. We needed that.
Mhm.
So I think that would help, get more
Mhm.
eyes on that project that we did. So
Great.
Yeah, great. No, thanks for being there. That was great.
it was really good.
The salsa was delicious.
Yes,
It was
that's
really
right.
good. And in fact, I made it the next
Yeah.
day.
Yeah, my kids loved it too. I brought it, they had extra. I'm like, I'll take some. They loved it. So we were getting the kids to eat it, I mean, I think we had maybe one child that didn't really like it because of the garlic, you know, but other than that, everyone's like, give me more. And the police were right across from us and they kept coming over and they were like, can I have that recipe? So it was good. It was a good day, so. All right, and then the other highlight I'll mention is that we have an influx of housing concerns. I don't know, we've gotten inundated, Diana and I, with doing these mental health type housing. And I think usually we get one a year, and now we're getting like one every week, it seems. Like we've gotten a lot of challenges with those. I mean, we're working through them, but this is something I've already mentioned to Tim about like how we're missing that social worker piece. Kim Kitters had left, I don't know if you've heard that. So we've been kind of, you know, trying to use our resources at the CAF as far as working out, you know, someone that this occupant could connect with to, you know, reinstate back into the home once it's cleaned and things like that. So that's something we're working on, so.
So you just said Kim has left? Okay.
She was the law enforcement embedded
Yeah.
social worker that was shared between Needham and Dedham. She got a promotion within Riverside.
Okay.
So that, I guess is good for her. It's a challenge for us because obviously we're still trying to get the law enforcement embedded social worker program off the ground.
Yeah.
And having turnover this soon is not ideal.
Oh, hi.
So we
I don't know if you guys can see. So introducing myself, Diana Acosta, environmental health agent. So I just wanted to add to the housing, going to another house today after the meeting, right after the meeting. So a lot has been happening at the housing authority. I think some residents have heard that I've been doing inspections there. So now they're kind of piling up, getting a lot of complaints about moisture in the houses. So what I'm seeing is a lot of mildew building up, and I feel like it has more to do with the building itself and, you know, doing the inspection, coming in, taking pictures, sending to the housing authority. Getting difficult to see what the next steps could possibly be because it seems to be coming through the walls and everything. They've given some residents one dehumidifier when I think they need more dehumidifiers to actually dry out the units, because when you walk into these units, it does smell, you have the heavy smell of moisture. It smells like you're walking into almost like a wet basement. So just looking for the next steps, might have to go to the state, report it a little bit higher, just so more action can be taken for these residents.
We know the source.
So what I'm
Kathleen.
seeing is I'm not really seeing gutters or anything. So I feel like there just has to be more work on remediating how to get the water away from the foundation from the buildings. Because I think a lot of it is housing. The houses are on slabs, and I'm not sure if there is vapor barrier, anything put in the floor, because every single apartment that I've gone into or house that I've gone into, I think that it's coming in from the floor. That sometimes I haven't seen the floor sweating per se when I go in, but I see a lot at the juncture of the floor and the wall of where things begin to happen. They've had to throw out furniture because the mildew mold starts growing from the bottom up. So it's anything that gets put on the floor starts getting spots on them.
And is this sort of new this year? Were you in any of these homes last year? You know,
It's
like,
not new because I
July
got a
and
similar
rain.
complaint prior to the pandemic, but I feel like I'm getting a more of an influx, especially because the summer was so wet that it might be exacerbating the conditions.
So how has the housing authority responded to this, Diana?
They will respond by saying that they'll put in a dehumidifier. They got in for one of the houses, they got somebody to come in from a company and test, and that test said that there was nothing wrong. But I feel like it's kind of like being put on the resident, like it's their fault that they're not cleaning enough. Because in the report, it said the house was dirty when they're telling me that they're constantly cleaning to keep those spots from reforming on the walls. So it's just interesting.
The dehumidifier is a Band-Aid. I mean, there's a source, there's a problem, right? I mean, yeah. So, okay.
I think one of the challenges is potentially, and this is not something that's confined to Needham, housing authority buildings around the country were built quite a long time ago. The federal government has changed in the 1980s. It changed how it provided funding for housing authorities in terms of prohibiting essentially new construction. And so one of the challenges I think facing Needham, and it is a challenge both because of itself, but also the challenge of the housing authority not being a town of Needham department, but being a separate entity, is how do they get the capital to do significant upgrades to buildings. In certain parts of Boston, I'm going to forget the name of the major project in Southie, but the Bunker Hill Housing Authority, one of the things that the BPDA and the Boston Housing Authority did was work with a developer and essentially give the developer the ability to build lots of market rate housing at the same location, much denser, as long as they refurbished so instead of say 2,000 units in the Bunker Hill Housing Authority location, there would be 4,500 or 6,000 units, 2,000 of which are the replacement affordable units and some number of them which are market rate. So the city didn't have to invest capital, but the developer invested capital in exchange for having the ability to build denser. It's certainly something Needham might need to consider if it hopes to reinvigorate its housing authority stock. But it's a complicated issue because it's not a town department necessarily.
And I would go through the planning board to start.
It would certainly have to. I think I imagine you'd be able to find developers who are interested in that. That would be one of the challenges, of course, is that the Needham Housing Authority properties, I think probably by intention when they were built in the 50s and 60s, were not close to the sort of center of town. They were located on the periphery of the community for many reasons, I'm sure. But that makes it much more challenging to necessarily build denser at the periphery of the community because it doesn't have good transit access.
Now, getting back to the social worker, is that
Carol,
a position that we're
sure. So
looking to
Carol
recruit for?
mentioned
Not us, but-
in a comment that Kim is still working part-time for Needham to help until a replacement can be found. So that's valuable. I do know that I believe Deputy Police Chief Chris Baker is the one who's going to work with Riverside for interviews.
Are there a lot of people who live in the Needham Housing Authority also in Mary Ann's traveling meals
Some
program?
are, not, we do have some here and there.
Because that's at least, one way we have of
Okay.
checking on people, identifying problems before they get to your desk.
How else can we, as the Board of Health, advocate for this situation? Because, the safe housing is extremely important to good health. And it is concerning, really concerning if folks are having these issues,
Sure, we're advocating for accessory dwelling units, which is going to be new, but we need to look at our existing housing and make sure that that's safe. I totally agree.
I think, one of the things that the town is working on is trying to decide priorities for spending American Rescue Plan Act funding. The example I gave from how Boston is doing it doesn't actually involve funding. It involves potentially zoning changes and giving permission for a developer to build denser in exchange for providing the entire cost of renovating units. And the way they've done it, I think in Boston, is the developer has to renovate all of the housing authority units before it can build any of the market rate units, or there's some sort of staggered plan so that there's not there's a full commitment to the project. The Board of Health could certainly inquire with the Select Board and the Planning Board about whether there is some flexibility to support that. I think the Housing Authority and Diana and Tara work much more closely with them than I do, but I think they're in a challenging situation of having fairly limited funds to do regular maintenance, not necessarily having the funding to do sort of a comprehensive refurbishment of a building. If you're talking about problems with the slab of the unit, you're not, it's not the same thing as a coat of paint. It's much more
Right, and
complicated.
they're telling me that they're short-staffed at the moment as well. And at least for Captain Robert Cook Drive, I know there's plans within the early part of next year to start fixing some of those things or some issues with the building in that complex. But I'm also getting complaints like by Linden Chambers on Urick Road. So it's two separate areas. But I know that they are trying to do some sort of revitalization, but obviously very limited on money that they have.
Okay.
Are there other points, Tara, Diana, that you want to highlight in the environmental health report?
We hired a part-time environmental health agent.
Sherry Miller Bedeau. So she'll be starting, it looks like November 1st, that Monday with us. So we're excited.
Great.
So there'll be a 10-hour-a-week inspector. She's already used FoodCo Pro. So she's familiar with Lisa Berger's program, which is great. So we're going to have to train her now with that. And so, yeah, we're excited.
Can I just, I have one question about the Kendrick, and I know it's been going on for a while, but the report they just issued on the 6th, they talk about doing indoor air monitoring in units with and without the portable air cleaner running. And as you can see from the numbers, it doesn't get the numbers below the DEP indoor air quality. Can we just confirm if those units are not occupied? And if they are not occupied, why are they running air cleaners in there? It's like if no one's there, there's not really, it's not treating the air per se, you know, they should do something else to ventilate, if that's part of the remediation plan. Thanks.
Okay, so next would be travel meals. Not sure if Marianne is here.
She is. She's here online.
Hi, Marianne.
Marianne, can you hear us?
Hello, can you hear me?
Yes, we can.
Okay.
Hello.
Hi, good morning. So any questions for me since we have a busy agenda this morning? Any questions to answer for you? No?
No, it looks
Well,
pretty
numbers are down.
straightforward.
Yeah, numbers are down. Can't help that. People have moved. They've gone into rehab. Some people have taken 2-week vacations, out on surgery, doctor's appointments, and they need to be home to receive the meals. So we can't leave them if their doctor's appointment is during our delivery time. So that's about it.
And it looks like we had a similar decline last year at this time.
Yeah.
And you're in need of volunteers, right? I saw something in the high school newsletter.
You always can use volunteers. I've been getting a lot of inquiries from the high school, but they're in class during delivery time, so it doesn't work. So,
Do they have to be 18
um,
and they be 17? Or,
yes,
you know, like driving, but-
yes, they need to be 18 as well, but
Okay.
I don't get to that point with them because the time frame does not work for them.
Okay.
All right, thank you.
Thank you.
You're welcome.
Okay, so next would be administrative updates, Board of Health regulations, accreditation. Lynn Chef.
Promote Linda panelist. Hi, Lynn, can you hear us?
Okay, sorry, I'm muted now. I actually have nothing to add to the report, but I'm happy to field questions.
I guess the one question I might add, Lynn, is we haven't gotten the report yet, but our participation in the Public Health Workforce Interest Survey.
Yeah, we have gotten 100% participation from our staff as of yesterday morning. So what that means is that we will be getting a report from the group that's organizing this survey. We'll be getting a report specific to our department.
Which we think would be useful for sort of staff development and training going forward, but also as a part of accreditation, right?
Yes.
So we're happy to do that. We just barely qualify to be big enough to participate in the survey. So having 100% participation was critical.
Yeah.
That's it for me.
Does anybody have any questions for Lynn?
No, it looks like you're working on a lot of updates and writing these days.
And I just moved her back to panelists, sorry.
Oh, okay, that's okay.
Okay.
No.
We had talked about just having monthly updates on accreditation. So,
yeah,
I'm glad that's included. We'll keep doing that. Okay, so next is substance use prevention. Karen
Morning.
Shannon. Hi, morning.
Hi, everybody. I don't have a lot of updates from the report that is submitted here, but I'm happy to answer questions. I can add that we have been very busy with SPAN initiatives. We spent a good amount of time in September getting ready for the SPAN quarterly meeting, which we had on October 5th. And I felt we had a really good showing on Zoom. We had 29 people and a really impactful presentation on the focus groups that we held last spring. So there was a sharing of data by our consultant for that. And in terms of other SPAN activity, we're getting ready with the community action team to launch a messaging campaign on impaired driving that will combine both video and sort of individual educational slides that we'll put into a media format that will make it hopefully appealing to the target audience, which is our teens and young adults. So it's the impaired driving risk while using marijuana specifically. And both of our grants are still moving along. The STOP Act grant has the disparity impact statement just about ready to be submitted. And now we're turning our attention to getting ready to renew the TIPS training program for our alcohol licensees. And our vaping grant is also working on a renewed promotion of the cessation program through our high school nurses. And I would like to comment that the nurses have told us that compared to last year during the pandemic, when they had about 5 student visits per week, now they're seeing upwards of 90 students per week. And they look at that as a touch point opportunity to open the conversation around vaping if it's appropriate with a student. And having the cessation program as a ready resource just makes it all that more accessible to students, especially as the nurses are the ones who engage them on that program if a student's willing to consider it. So we're pretty excited about that. And just one other note, the salsa program at Needham High has started off the year with their first general meeting. They drew about 75 students to that meeting, which is tremendous. And at that meeting, the leaders asked those present if they would, in their phones on a Google form, indicate their areas of interest for the action teams they'd like to join through SALSA this year. And vaping awareness remains a very strong topic of interest. I think it was about over 60% of the students indicated an interest in that. So we know from, at least anecdotally from that perspective, students are still considering vaping to be a concern. So more to come on that. Can I answer
Karen,
any
you
questions? Yes.
Karen, you mentioned TIPS training.
Yes.
I think that is something that the substance use prevention team and SPAN probably want to talk to the board in more depth about in future months. I think the board in the past has wanted the town to take the training and enforcement of alcohol regulations as seriously as the board takes its training and enforcement of tobacco regulations.
Yes.
And one of our thoughts is that offering free in-person training for all Section 12 and Section 15 licensees
Correct.
So on-premise and off-premise licensees would be one way to help sort of better inform safe beverage service and responsible practices.
Yes. So our prevention folks who are dedicated to the stop grant, Jasmine and Monica, have been meeting with Carol Reed to really kind of collect all of the historical information that we need in order to renew the plans for tips going forward. So Carol's been really helpful, giving us a lot of the information through her experience. And as you know, she's certified in tips training, so she will be assisting us once we're ready to begin the promotion, picking a date and promoting that to the alcohol licensees in Needham. And Carol, if you feel like you want to add anything to that, please feel free.
I just wanted to comment on what Tim said in the alcohol regulations with our SAPSI grant, Tim, how during that summer when some of the regulations were expanded for licensees, you got the selectmen to add that training would be mandatory in person. The gap that differs from tobacco is the Board of Health licenses and can enforce the mandatory training. But with alcohol, that enforcement of attendance is left to the selectmen.
There is a new support services manager, Sandy Sincata, who's a longtime town employee, did retire. Miles Tucker is a new employee, and he's very into sort of policies and procedures. He's met with me and a number of the staff already. So I think we're looking forward to discussions with him about how we can make sure that license renewals can be sort of dependent on proper completion of training and proper documentation that all the staff who are going to be in an alcohol service role have had, have reviewed the regulations, have watched the video, that sort of thing.
Yeah, I think it's timely too, because I think in the at town meeting, in one of the warrant articles is to increase the number of
It is.
alcohol licenses
Mhm.
Yes.
for retailers in town. So very timely. Karen, I had a question about the impaired driving campaign that's focusing on cannabis. Do we have anything similar to that, or will it be included related to impaired driving due to alcohol or even medications which may be prescribed, which can also impair driving?
So the community action team is the group behind this campaign, and their focus has been primarily on impaired driving while using marijuana. Although when we developed the PSA, we mentioned, of course, I believe there's reference to alcohol as well. Any kind of substance in your body shouldn't, can impair you, obviously. And the message is that you shouldn't be behind the wheel with any substance. But our emphasis has mostly been on cannabis, just because we felt that we got a lot of feedback from students anecdotally that they have internalized the message around not drinking and driving through years of that campaign in the past, and felt that a lot of students just aren't thinking and they're not aware of the impact on their brains and their fine motor coordination, their muscle coordination, if they've been using marijuana. So it was really through a combined effort of different input that the team was placing a little more effort on the use of cannabis while driving. But we also plan to make it more of a series. So there's going to be an opportunity to add more messaging around impaired driving. And I know some salsa students are looking to work on this matter as well. So there'll probably be some energy with their efforts to combine with ours and make it more of a robust messaging campaign.
That's great. I look forward to hearing more on that. Okay. Questions for Karen? All right, so we'll move on. Thank you, Karen. We'll move on to public health nursing. Tiffany, Hannah, Mary.
Morning. Mary's probably not going to be on, but Hannah will be. And I'm not going to lie, I'm remote desktopping from home, and I don't know how it changes to my home webcam and not look at my empty chair at the office. So sorry,
It is
you're
quite the
probably going to hear my voice unless I can figure that out. Oh, there we
There
go.
you go.
There we go. All right, pick the right camera. Okay, so for nursing department, this month we have really, or I guess last month, really focused on flu clinics. It's flu clinic season, trying to get those rolling, working on those bits, and what do you call it? COVID booster clinics have been the big key for the nursing department this week or this month. So yeah, those are the main things. As far as the communicable disease, I'm not sure what the invasive bacterial infection is, so we'll have to get a little bit more information on that. And the other one, the Campy, was just lost to follow up. So we are monitoring closely the Lyme disease to see the trend between this year and the last couple of years, because I have a feeling it's going to tick up. So we'll be working on that. That was not a meant pun, but it worked out. Yeah. Hannah, anything you'd like to add?
Maybe I can just say, I don't know if maybe this was discussed or mentioned last month because I wasn't part of the meeting, but I did attend the Matter of Balance training last month for a week-long training, and we're hoping to start that program again in Needham, maybe January. And what that program really is, it's reconfiguring the mind of an elderly or more mature person to be less afraid of falling and more able to continue their active lifestyle in the community.
It's an evidence-based program, and so we would work closely with aging services to offer it, and we're really glad that Anna's going to be a trainer.
Yeah, I think we lost.
And that's training that's offered in individually in the home, or is it like at a group?
It would usually be in
setting, like
a
a
group class setting. Yeah.
Okay.
We
Yeah,
do have
and
a
it's very-
program.
Oh.
Go to.
I was just going to say it's very specific on how you do it. So it's a 8-class course, and you can either do it 2 days a week or 1 day a week for 8 weeks. And it's done based out of Maine Health, who really piloted this program and really put it together. And it's pretty well known. We were before COVID, we were using it with the stay-at-home, safely stay-at-home program that we had piloted. Thank you. With the social workers, and we had done that portion. And then after we did an assessment for them, we'd invite them to that class and see if they would like to join and things like that. So yeah.
Yeah, so the program we had gotten a grant a few years ago. The social workers were trained to sort of do an in-home assessment to provide some small free items to residents who are looking to stay in their home safely, and then refer them to this evidence-based class for free to help them be sort of aware of how to fall safely, less afraid of it, improving the balance. So it's a nice synergy between two departments.
Great.
Just one other thing I might mention is that we did extend an offer to a full-time epidemiologist last week. The goal is for her to start around November 15th, as long as all the paperwork and everything like that.
You broke up a little bit there, but around November 15th.
Yeah, sure. We got a lot of static from you, Tiffany. November 15th for a full-time epi. We are unfortunately still waiting for the packet of contact tracers from HR, but we can talk a little bit more about that. Tiffany or Hannah, I was wondering if you could bring up, it's in other items at the bottom of the agenda, but one of the challenges we had with a camp in Needham this summer.
Oh, sure. Tiffany, do you mind if I just go ahead with it?
Yeah, go.
Okay, so this is for Needham, And we received several inquiries from places, and one of them was St. Sebastian's, and they wanted to hold a summer camp that they initially, when they filled out the application, they implied that they were going to do it for 1 week. Because they had never held a camp that the town had licensed, or one that I guess qualified as a camp, they have to start really the paperwork from the beginning. And we did go a lot of back and forth. I think I had like 20 emails with the camp director about the requirements and trying to help them really get the application ready for our review. I was leaving to go on vacation at the end of June, at which point they were still working on the application. I passed it on to Mary and let the people know at St. Seb's that, I'm going to be gone. For some reason, when I came back in August and I reached out to them and said, hey, we need to come and inspect your camp. It's about to start next week. We still don't have your application. After several tries in trying to get a hold of them, I received an email and said, thanks so much for your help. We had our camps in July. Everything went great. I looked back on the website and they had actually 3 weeks of camps. And technically they were running them without a permit from us.
So while Hannah was gone, Mary had tried to contact them as well a couple weeks, because our requirement is that all paperwork is turned in 2 weeks before in advance so that we can review it and go through it and look at kids' health records and things like that we have to approve, and the staff health records, and they never contacted her either.
There is a state regulation around camps, and so the public health department enforces it, and it's specifically the nurses that make sure that camps are following state regulations. So I think this was a frustration for us, that we sort of made pretty clear there was a process. There was some confusion, and not having done it before, I think it feels a little daunting, but we were trying to work with St. Sebastian's to go through that process. And I think we felt that they pretty clearly understood that they had to do this and didn't. So I think we have quite a lot of frustration about that. There's also the fact that there's an expectation that camps are licensed and safe, and it will certainly look poorly on us, the public health department, the Board of Health, if there is a camp where there's a communicable disease outbreak because the regulations weren't followed. So we're bringing it to the board. We don't necessarily have a recommendation on action to take, but it might be worth further discussion.
Do we know what qualifies as a camp versus like a program?
Yep.
And did they feel like they were in a gray area or something?
They definitely were not in a gray area. That was communicated multiple times. I did, when they realized the extent of the application, I did offer them the alternative, which is to have the clinic run for 3 days in a 14 consecutive day period. So out of 2 weeks, you could have a program for 3 days total in order for not it to be considered a camp. So they had that option, but they chose to go for 3 weeks of camp.
So the other things with a camp too are if you're a drop-in only and don't make appointments, that's one way you're also not a camp, or it's less than 2 hours a day.
And
But that
these are
didn't
not
apply.
right. These are not Needham specific regulations. These are statewide regulations that are in place everywhere in the Commonwealth.
Yeah, no, I meant were they misinterpreting or something?
Yeah, and I think if they had done 4 days and, it wasn't a, they way overshot.
Yeah. And how is it that the 1 week versus the 3 week, like, did they change what was on their website? Did they submit something that said we were having a 1 week camp and then change their mind, or we don't know?
No, so I'm not entirely sure, because the initial application that they gave me, I think that was probably in April or May, and they just list kind of like what dates they're planning on running it. And that was honestly, that wasn't even for July, like that was for August. And then when I came back in August, they had ran the camps in July. So I don't know at what point they had changed that. but they never communicated to me or to anybody in our department that they were planning on speeding up the camp. And the other thing is because they're a private school, but the camp was open to anybody, like it wasn't just for their students. And they had a lot of kids in all those weeks.
If it is their own students, does that make it different in any way?
I guess they could classify it as an educational program, enrichment program.
Yeah, I
It'd be
would
hard
think
if it
we'd
was
have to check with the
exclusively
state, but I would imagine it would be more a school-run process, like a summer program, like Needham Public Schools does type of situation.
So now, after the fact, did you reach back out to them, and what was their response?
Tiffany or Hannah, you can correct me. I believe their response was, yeah, thanks for your help. We did 3 weeks. We're all done.
But
So,
we didn't
yeah,
give
and
them
that
a
was
response.
that was the
That's to say
response to my.
Your camp is actually in violation of the laws of the state of Massachusetts, which we're responsible for enforcing.
So Tiffany or Hannah, I don't know if you heard that. Did we follow up we ran it in July, thanks for your help with, hey, you did this wrong? We think
So
they knew
that's
that they
where-
did it wrong.
Sorry, I'm having trouble hearing. Somehow my sound is muffled right now.
So that's why we thought we'd bring it here, and it was on last month, but we didn't get to it last month either. It's because we didn't know if we wanted to do the call out. We have never had an issue like this before. We've had an issue where we've had to shut one down because of unsanitary conditions during the middle of camp, but I've never had a camp run that I am aware of that did it illegally. So we didn't know if we'd want to hold a hearing and do an official type letter to them. We are aware you did this. We can just send an email, but if this happens next summer, what do we do in that process, right? So that's where we're bringing it to you guys to help us determine what course of action we should take.
There is the opportunity to fine them, which I would have to double check, but I think we could fine them $5,500 because there were 11 violations, or I guess 12 violations technically. There's some things we've done in the past when people have blatantly operated without a permit, which is that they don't get permits to operate again for a year or for longer. There is the opportunity to have an administrative hearing or to sort of issue a letter of concern. We think it's an important thing to follow up on. We don't think it's appropriate for people to do things illegally, especially when they know it's illegal.
And are involving children.
And are involving children. I think there's not necessarily an urgency, right?
Right.
If it had been urgent, we would have forced it onto even it was on the agenda last month, we would have made sure we got to it. I think because it didn't just happen, we've got some time for the board to figure out what it thinks is the appropriate next step, but we wanted to bring it to you for your consideration.
Okay, I mean, my feeling is that, an email is probably not enough. And we've had email communication, and it sounds like when they were told that they had done that in violation of email, they were like, okay, well, everything went great anyway, which is really not the right response. Obviously, we don't want it to happen again. It doesn't sound like it's going to come up again until next summer, but I think a letter from either the health department or the board kind of outlining the violations that happened, that we understand it was their first time and it's a complicated process, but we are, as we were, willing to help them get through it, as all other camps do, for the safety of our kids. And, we certainly don't expect that to happen again. And, there are penalties if it does happen again.
Yep.
That would be my sort of
Yeah.
approach, I think.
Yeah, I agree. I mean, I start to wonder if was this all correspondence with one person? Could it, could there have been some miscommunication that others were involved, or
Right.
I
What
don't know how this could, how it could play out like this. But I do think it is important that we address it. And
Yeah, and I think the letter should go not just to the person who organized the camp, but, maybe
Yeah,
they're the
yeah,
only
that is
person that
cool.
knows that they're in violation of this. It needs to go to the head of the school and,
Yeah.
maybe even their board of governors or whoever they have that oversees the entire school. We consider this a very significant violation. And we don't see that again.
And it's unfair to all the camps that do it right and spend
Right.
money and resources and time to yeah.
Right. Exactly.
Yeah.
And it's, you know, those are the rules, it's the law,
Yeah.
and it's there for good reason. But I mean, my sense is that we shouldn't fine them based on this.
I don't think we've historically in Needham taken
Yeah.
fines as some communities use fines and like to, make money that way.
Mhm.
We historically have tried to figure out how to educate and inform and get compliance that way, or when necessary, threatens the wrong word, but remind people about the repercussions of not following the rules rather than issue fines.
Sure.
I technically have a fine book. I don't know where it is. I think I lost it in the tar.
No, and I'm agreeing with that.
Okay.
Great, thank you. We appreciate that. Draft that. Do you guys, and sorry, I'm trying to decide what to do exactly, because we send out our first correspondence to our camps in February. So we will work that through fairly quickly and then send that out.
I mean, before February, right?
Yeah.
Yeah.
We want to
okay.
discuss it maybe more next
Yeah,
month.
in the next month.
Okay,
It'll be
so-
done within the next month.
Okay, so we'll have a draft for next month, and then we can send it off so they're well aware before the February process starts.
Yep.
Great.
Yeah, perfect. Thank you.
Okay, thank you. All right, so we're a little behind. We'll move on to emergency management. We have Talib and Michael.
So I believe Talib's up first with a brief update.
Good morning.
Good morning.
Good morning.
Summary of work helping Tiffany to apply for the Berkeley Gale Seed grants and to combat misinformation during public health emergencies. And we are working to write our grant about train the trainer program. So right now we are looking for 3 keys of training, how to use social media to combat misinformation, and how to reach different population for misinformation. And the third training, we are looking for the emergency messaging about emerging public health threats. For the second thing, September is the National Preparedness Month. As each year, we took this opportunity to promote personal and family emergency preparedness and share numbers of education resource and preparedness tips with our volunteers. And we also took the opportunity and reach out to the Brookline Police Department, and we coordinate with them to share a series of training with our volunteers. It was about house of worship to prepare for unthinkable. And for example, they had active threats and preparedness. The second training, it was about crisis intervention and de-escalation. And the last one, it was about site, like to train the security personnel on the site. The third thing, I have been assist the public health nurses with the vaccination clinics task. For example, like set up the clinic, reach out to our volunteers, non-medical volunteers to help us with the clinics. And this is my update from my end.
Okay, thank you.
Yeah.
Do you have enough volunteers?
Oh, yes, always.
Good. All right, excellent.
That's really exciting to hear about those public health messaging related projects that you're hoping to work on if we get these grants.
Hopefully.
Great, thank you. And now, Michael?
Good morning. this month, we began planning with MEMA for our commodity points of distribution. This is a way to distribute something like water bottles in the event of a water disruption. The police identified the Newman School as their primary or their ideal location. And I believe that would work well, since if point of distribution is needed, it's unlikely that school would be in session. But we also identified as a backup as the DeFazio Field in the event that the schools were in session if a commodity point of distribution were needed. So the next step on that process is for MEMA to come out and actually do their own site surveys. But I did provide them with traffic plans that the police had drafted up in advance. We're also continuing to work on the staffing updates, continuing to get names for EOC members from department managers. And I have a grant that's almost ready to go to MEMA. I'm just waiting on some last information from finance department. So that'll allow us to conduct a hazard and vulnerability assessment next year, which our last HVA was conducted. It was completed in June of 2017. So looking forward to getting that done again and updated, and then going back and making sure that our plans reflect the latest hazards and that the town faces. Also last month was able to do some good community outreach, both at the Harvest Fair, getting people signed up for the Rave Alert, and also had a community presentation for some of the au pairs in town on general emergency preparedness, along with some of the other people in the fire department. So it's been a good month. Are there any questions for me?
Not for me. Thank you for staffing the booth. I saw you there and appreciate your time commitment to that. Okay. All right. Thank you, Michael.
Thank you.
So we'll move on, I think, to the COVID-19 update.
Yes.
No, I'm sorry. The next is,
Yep, you're right. COVID-19 update.
wait, COVID-19, sorry. Yes.
So I'll go through the presentation very, very briefly. We feel like we're in a pretty good place in Needham right now. Cases have been hovering in the 10 to 15 range. This week, they're going to be down into the mid 7s. We have seen our positive testing rate fall now to almost 1. When we would look at this slide that has sort of Needham and some surrounding communities a few weeks ago, we would see everyone heading up. Now we see almost everyone heading down, or 1 or 2 communities sort of level. So there is a positive sort of momentum. The start of school has not yielded a massive influx of cases. It certainly made for a busy couple of weeks, but transmission is actually, Tiffany's telling me our positive rate will be under 0.7. So under 1%, which is great. I think when we think about sort of our August cases, we saw a brief sort of increase in the number of school age cases at the end of the summer, more before school started than sort of when school started. Our average age of our cases in September is 37, which is slightly lower than it has been, which is a trend. So when we think about COVID in its very early stages in spring of 2020, the average age of cases was in the elderly population, right? With significant outbreaks in some of the long-term care facilities in town. Over time, that has gone down. So now about just over a quarter of our cases are in those people under 18 and under, rather. Cases in children under 12 are now about, for September, we're 16% of our total cases. Obviously, we sort of pay particular attention to the under 12 because those are the people who are not yet eligible for vaccination. So we're glad that that went down. I think, there's a chart, get to page 38 of the packet, where you can see the percentage of monthly confirmed cases among children under 12, and you can see sort of some fairly rapid swings of 26% in April, 16% of cases in May, 0% of cases in June, going all the way back to 27% of cases in August and now down to 16. So certainly with school in session with full attendance, not last year's sort of cohorts of one group in class this week and one remote. The fact that cases are down from August amongst the under 12 set is a very good sign. In September, there were a total of 360 in-school student contacts. One of the things that does make life busy for Mary and the contact tracers is that an adult case, as the board knows, will often have a handful of close contacts. When you're talking about students in school, you're usually talking a couple dozen contacts, depending on what sort of grade they're in. We've been fortunate, I think, in that the test and stay program, and we'll get into that a little bit, has enabled us to keep the vast majority of people exposed in school who are identified as a close contact have been able to stay in school. That's been very valuable. I think one of the goals, of course, for the start of the school year was to balance the infection control and the prevention of the spread of COVID with the sort of paramount goal of keeping kids in school and increasing time in learning. Last year, there were a lot of close contacts who did not develop COVID, which is a good thing, but they were quarantined for extensive periods. There were one or two sort of unfortunate people in the spring that were, quarantined for, almost 2 weeks, came back and like a day later were close contact with someone else and had to quarantine again. A lot of people missed time that, didn't have COVID. So I think the fact that we have a test and stay program is valuable. I know it is time consuming and challenging for the school staff and the school nurses. But the state has sort of gotten a little bit more organized. There were some real challenges getting supplies for the program and getting the staff that the state had promised for the program. I think you may have seen the Globe headline earlier this week that Governor Baker is going to utilize part of the National Guard to do in-school testing. That sort of speaks to the challenges of getting sufficient staff to run the testing. In Needham, according to the state data, we have about 82% of the population is fully vaccinated. 89% have at least one dose. And when you look across our age brackets, we're hitting 90% across each of the age brackets have been vaccinated. Now, I will throw the caveat out, the state is still using 2010 data. It hasn't moved over the 2020 census data set yet. So when it does, and I'm not sure what it's waiting for, when it does, these numbers will shift slightly. The overall picture of the fact that Needham is a very well vaccinated community and that the vaccination rate is universally high across age brackets, that won't change. The exact number will fluctuate a bit. Our youth vaccine uptake for the 12 to 15-year-old age set and the 16 to 19-year-old age set are 94 and 92% respectively. That's a real positive. That's a very high rate. We're glad to see it. One of the things we have been talking about is and Dr. Partridge, you see this, and Dr. Epstein certainly sees this, the decoupling of cases from hospitalizations. So the fact that there may be an increase in cases, but there's a much more modest increase in the acuity of cases, the cases that might need hospital admission, the cases that might need intubation and an ICU stay. That sort of seems like that decoupling where we have cases go up, but the severity of illness is still modest. That looks a lot more like what we see in a flu season. That looks a lot more like an endemic disease, which is something that we can manage. It will continue to be a challenge in some years to the health system, but that seems a lot more manageable than sort of the societal wide disruptions that have been in place for the last almost 2 years. State trends have been the same. Hospitalization rate among teenagers is still very low, which is a good thing. Even without being vaccinated, those in the under 12 age set generally have a much more modest course of illness than people in older age brackets and those with high-risk conditions. And that's the COVID update. I will let folks know the Needham is not going to make a change in the immediate term, even though it does have more than 80% of students in the high school vaccinated, as well as more than 80% of staff vaccinated. Needham is not going to make a change to go mask optional in the short term. I think the superintendent still loves the idea of eventually getting back to a mask-free learning environment when it is safe to do so. But we don't believe that point is right now. And it certainly warrants more discussion. I personally think that I think maybe the calculus changes when we have the under 12 age set vaccinated, because then the risk to high schoolers who might have younger students is much lower. I do think that I find it hard to argue with the fact that there are so many people in close proximity in a school setting that I wonder if it's appropriate to continue masking for the rest of this academic year. I'm not sure, but I know that at least right now, it doesn't make sense in Needham based on the data to take masks off in school yet. But that is something the Joint Health and Safety Committee is looking at and is going to kind of continue to assess over the course of the fall.
Yeah, I mean, I was unable to make the Health and Safety Committee meeting on Monday, but yeah, my personal feeling is that we have a group that we've got to protect. That's the 5 in school. That's the 5 to 11-year-olds. So I think it is too early to talk about going mask optional, especially since we may be very close to emergency approval for a vaccine that may come even at the end of this month. And then in my next comment about that is whether we're going to be having any clinics for the 5 to 11-year-old group, or if we may go through the benefactor from the pharmacy who helped with the 12 to 17-year-old group.
Sure. So I'm trying to promote Tiffany to panelist, but for some reason it doesn't seem to be going through.
Because my sense is there'll be a lot of interest.
So we had conversations, both Tiffany and I have, with Byrne Patel, who owns a pharmacy in Waltham. He's a Needham parent. And he helps do a number of clinics for when the vaccine authorization was extended for the 12 to 15-year-old age set. We have some details to work out, but what we had decided was that we thought it made sense for him to sort of, when the EUA is extended, for him to get his staff and volunteers together, for the public health division to get our per diem nurses and our MRC volunteers together, and to sort of divide and conquer, so that between the High Rock and 5 elementary schools, depending on capacity, the PELMEDS team might take 2 or 3 schools, and the public health division team would take 3 schools, with the goal of getting those 12 to 15 or under 12 youth vaccinated as quickly as possible. I think the schools really favor, and Tiffany, you can jump in here whenever. The schools like the idea of during the day, during the school day. The police love the idea of during the school day, rather than having 500 parents and 500 cars with 500 kids all coming. I think Tiffany and the team this weekend at the flu clinic did have some experience with one young person who had a very, very strong reaction, emotional reaction to the thought of getting a shot. And that was very upsetting to all the other kids who were there. So I think one of the things we have to figure out how to balance is, if we could do it during the school day, that would be great, but how do we sort of identify which students might have challenges getting a shot? Is there ability to bring in some parents to sort of calm them? Because I don't think the public health department is not going to restrain a child to vaccinate them. So if they are sort of fighting or upset, we won't vaccinate them.
Yeah, we could also have just been thinking about this a lot, like have an alternative room if a kid starts going, and maybe just one of the nurses step out with them and see if they can get it. But it really doesn't allow us to get them done in a timely fashion, that we don't disrupt the school or the other kiddos' ability to get it comfortably. So just trying to work out those logistics. We think and believe we can do it either. We can do it during the school day, we can do it at home or on the weekend, but it just depends on, what the logistics would be for those kind of pieces that we need to work out. But the nurses are prepared, and we've rallied our other nurses and our per diem and MRC members to see if they're comfortable vaccinating children. So.
Does during the school day mean, so none of the parents would be there with the kids? They would just be doing it? Okay.
The schools.
Correct. They did that H1N1.
Right.
Yeah, they did it with H1N1 that way. So.
What'd you say?
During H1N1
Oh,
that year, they gave flu
Yeah.
shots that way, and the schools liked it when it was during the school day.
Okay.
I think the police like that too, just because, like I said, cars for, every kid has a parent that has a car, makes for quite a lot of traffic.
Mhm.
I think there's some real question about, is a sixth grader comfortable getting a shot? Possibly, probably, when do you get into this person isn't comfortable? Is it
Mhm.
third grade, second grade,
Mhm.
first grade? I think there's a question, and certainly it would vary depending on the person and circumstance.
Yeah.
But yeah, how do we sort of tease out who really needs someone to be there for them, who can get it without? And, is there a way to make it so that the majority get it without a parent? Parent would obviously have to approve and sign a consent form. But the schools don't love the idea of bringing in that many additional people.
Yeah, like from exposure standpoint, like
Yeah.
the fewer people walking in, the better.
Yep.
Can they do it like from 2 to 6 PM or something? So you sort of straddle that and then the kids go home and,
So we are pretty flexible. Burren, I don't know for sure, but Burren has been pretty flexible about everything.
Mhm.
So I don't think it would be, I can't speak for him, but I don't think it would be fair on his end. Dan, who I like working with a lot, is always very sensitive about protecting the school day. And I was surprised at how willing he was to say, why don't we do it during the school day? That will make things easier. We have flexibility. We could do 2 to 6. We could do 10 to 2. We could do Saturday 9 to 5 or something. We have flexibility because we have a very dedicated pool of per diem nurses and full-time nurses as well as MRC volunteers. I think the goal would be between PelMeds and Needham Public Health to vaccinate everyone who wants it in the 5 to 11 age set quickly, like within 7 days.
Yeah.
Everybody gets a chance to get their first shot, or maybe 8 days or something, depending on, who knows, it could fall with like a holiday or a holy day or something. But we would want to try to get everyone as quickly as possible. Therefore, they could get their second dose, since we're talking Pfizer, 3 weeks later. And if it was approved by the end of the month, maybe you're talking about people having a first dose by the first week in November and having their second dose around Thanksgiving.
Right.
So that the winter holidays, young people would be fully vaccinated. That would certainly seems like that would be a very good thing.
And the experience we had with the H1N1 vaccine in the schools, I mean, that would inform us about kind of how well it's likely to go with
Yeah.
certain age groups and, how many kids would feel too uncomfortable getting it at school.
Right. And certainly, we can and will make arrangements for students with particular additional needs or social emotional issues that might specifically need a different setting. We can certainly do that. I think it's just to be as efficient as possible. And we do have a 15-minute wait period. That's something to be aware of. Like maybe Miss So-and-so's classroom can come down and be vaccinated, and Mr. So-and-so's classroom can come down and be vaccinated. They can go back to their classroom and we can have a nurse, either one of our nurses or the school nurses, sort of stand in the hall and look at both rooms just to monitor the students for the full 15 minutes in case there is a negative reaction.
Do you need a nurse as long as there's one on the premises, like the MRC, the clinics? We did it. I mean, the volunteers sort of.
We would, Tiffany can get into this. We would want an EpiPen very close by, I think is that right, Tiff?
Yeah, we need somebody, at least first aid. It doesn't necessarily have to be a nurse, but they have to have knowledge of how to use the EpiPen if need be.
I'm willing to volunteer for that.
I think
I could imagine the
And I'm
little
on the
ones.
MRC, so.
I could imagine it taking some time
Yeah.
with the little ones. I volunteered for a day with PelMeds at the last clinic, and even some of the older children had trouble, and it took a lot of time.
Yeah.
And they would take them to the back. They had kind of a curtained off
Yep.
space and do it that way. But I could imagine.
Yeah, the school said they remember, some of the high school seniors remember bringing stuffed animals to school to be able to get their shot, stuff like that. So we'll really have to do a campaign of some sort to make them a little bit more comfortable, like bring what you need to hold on to, that kind of thing. So we'll figure out a few of the specifics that could help kids be more comfortable with it. So.
I would think the parents could clue you in too.
Yeah, that's true.
And they go to the pediatrician with the
Okay.
kid when they have their shots.
They know how, if they get anxious about it, sure, yeah.
Yeah.
And, they would probably have a strong opinion about whether they want to put their kid in that situation.
Absolutely. I think the example that Tiffany and her team told me about from this weekend is just 25 kids were perfectly fine getting a shot, and this one person unfortunately was very, very anxious and was yelling and screaming. And those 25 became much more anxious after that.
Yeah, absolutely.
Yeah, sure.
Absolutely.
So I think figuring out how we can try to avoid that
Yeah.
to the greatest extent would be.
And we know the timeline, like the meeting's on the 26th, ACIP will, like CDC will review it the next week. So
Yeah.
it really, like the 6th seems like early, like that's a Saturday. I don't know if we know. But that seems like.
I think it
the
seems
timeline.
likely. I think the question will be whether, they say, okay, starting Monday you can do this, or is it, starting 2 weeks from now you can do this? I think our goal would be probably to try to place an order like they're going to say you can do it, as of the end of this meeting. The state thus far has been good about getting us vaccine. This time around, it doesn't seem like there's any shortages. So that's a positive.
And then
Plus
you've
it'll
got
be a
storage.
smaller bill.
Okay.
Sorry, test and stay. I haven't found a case yet, right?
They've not found a case in test and stay.
The number of cases now is really low in the schools,
Well, they've had 100 kids in test and stay, right?
Yeah.
100.
but there's a number of positive. Last week was 2, I think.
Right, there's a very low number of cases.
That's actual cases.
I just, this will be for next month, but I just saw yesterday that, our kids at Sweat, at Smita Williams, all masking outdoors now. They've asked them to do that.
Oh, Michael did that?
Yeah, on the playground.
And whose policy is that? The school?
I don't know.
So I believe, if I'm remembering correctly, and Tiffany, you can correct me, that is a DESI policy.
Oh, for the playground, or
I think it is.
But they.
That's not
Masking on the
Yeah,
playground?
They haven't been.
No.
That just changed.
Pretty sure it is.
This week.
Unless it's changed in the last couple of weeks, Desi had no masks needed outside at all.
I'm sorry,
So
anyone who's in test and stay has to be masked outside.
Oh, test and stay.
Okay.
Sorry, is that what we're talking about?
Oh, it sounded like
No, but
it's a whole
the
school.
kids.
Everybody.
It's all the kids.
Yeah.
Okay, I'm
There
sorry, I
was an
misunderstood.
announcement. Yeah.
The
they
state
all
did
were.
require anyone in test and stay to mask outside at school, which I think is a little bit of an overreach. But I didn't realize that
Yeah.
SUNY Williams
I
was doing it
thought
for
you might know a
everybody.
little more. So you don't. Okay.
No, I didn't. Huh.
Hmm.
Okay, well, we can ask about that. I mean, I don't know if that is quite necessary, given what we know about
Mhm.
outdoor transmission and the incredibly unlikely chance that happens. But
I'm so used to the masks. Okay, so we should, I think, move on unless we have any more discussion on COVID pandemic and meeting. Okay, a note for the record that Ed Cosgrove has joined us. Welcome, Ed. And next up is the tobacco-free generation discussion.
sure. And so this was something that Dr. Epstein was interested in and asked me to mention to the board last month and include it in this month's packet. The town of Brookline passed at its fall town meeting in late 2020 the tobacco-free generation policy, which I included the text of the article itself, as well as the Massachusetts Attorney General's opinion that on the face this is valid. That's not a guarantee that some court doesn't find a flaw in it, but there's not any immediate flaws of law in the article. The general concept is that people born after a certain year will not be able to purchase tobacco or tobacco products in a community forever. So that there will be young people for whom they have never had the access to purchase tobacco products, never had the legal route to become exposed to an addictive product. So that is the sort of concept. We included the materials for the board to review. I don't know if the board has any questions or wants to sort of talk about it. I know Dr. Epstein was interested in discussing it. I know it was a complicated issue in Brookline. I think it was some members of the town's different bodies, I think including the finance committee, felt that there wasn't a thorough assessment of the sort of community-wide impacts, but it did pass town meeting.
So, I definitely would like to hear Steve's comments on all this. You know, I support the idea, I mean, we don't want people to start smoking, and it's one way of preventing it for life. It seems it doesn't seem so crazy to prohibit maybe at age 21, but then what happens 10 years down the road when they're 31, or 20 years down the road when they're 41? That's going to look as odd as their initial idea to ban cigarette sales for anybody born after January 1st, 1976 in Brookline. So, I'm not sure how it's gonna. I'm not sure how the community is going to feel about that. Because in 10 years, you have a 31-year-old who wants to buy a pack of cigarettes. I mean, you've already gone through basically all of your stages of mental development by that point, and you are an adult, and you can make your own decisions, even if they're not ones that we would support from a health standpoint.
I think two things. One is, do we have any statistics on how many people who reach the age of 21 and never smoked suddenly pick it up? It seems to me to be a very small number.
Yeah, I don't have Needham specific numbers. We could get state or national numbers, but it would be low.
And then the other thing would be, given the mood of the country right now, where nobody seems to want to be told that they can wear, that they have to wear a mask or get vaccinated, I don't see this going over very well. And we're fighting a fight that might just not be worth it at this point.
In our last Metro West Adolescent Health Survey, it's 2.4% of high schoolers are using tobacco right now, whereas at that time, 22% were vaping and 29% were using, had current use of alcohol, and almost 20% of marijuana. So it seems like there are other substance use issues that, with limited resources, that would really be a bit more of a priority for us.
It just seems like tilting at windmills at this point.
I mean, I think it seems to be part of this, I kept reading the phrase tobacco endgame, so it seems like this is an effort to phase out tobacco consumption long-term. But I do think that the timing for now is probably not ideal. And I think one of the arguments that I read that I thought was compelling is that, the impact on children, that we have, sort of phased it out in public places, but in private places, still there are children and other vulnerable populations that are being exposed to it. That this is one way to ensure that future generations, especially children, are not exposed to it in these private places.
I guess, one modification might be, there was some, I was just looking to try and find the data that that was in the packet about, basically if you're if you're over a certain age, you're very unlikely to start smoking. I think it was like kind of when you reach your final stages of brain development, like around, mid-20s.
Yeah.
So, one thing you could consider doing is to maybe raise the age to age 25 or something like that, just throwing that as an example, instead of continuing it forever, as Tim said. And that way you get everybody who might start to smoke at any point in their lives. And then after 25, they're not gonna, very, very unlikely to start.
Belmont, I think, did something like that with marijuana. They made it 25.
Yeah.
And that was the logic. That, your brain is fully developed by the time you're 24, 25.
Yeah. And the data seems to support that.
So you mean raise the minimum age to buy cigarettes to 25?
Yeah, something like as an alternative to doing something like this, which is would be forever for this population.
Mhm.
I think there might be more support for that.
Yeah,
I mean, and I think if we were really to consider restricting sales after, anybody born after 1/1/2000, I think we'd want some community input on that.
Oh, certainly. This would, if we were going to propose an amendment like this, we would certainly have to post it. We would have to advertise for public hearings. I think it was more the concept that Dr. Epstein wanted to discuss.
Okay.
I think maybe we should just, since he's not here, hold that for another meeting again.
Yeah, no, I definitely would like to
He
hear
seems
his,
to be the one who
his
is bringing that up.
comments and opinion on it. Okay, so we'll bring that back next month.
Yeah.
And we're up to pesticide reduction. Not sure if Ally is here with us today.
She was earlier. I don't know if she can come back. We are a little bit behind the 8 ball. Tara, maybe you could check if she can come back. Maybe, Mr. Chair, we could do either jump to the Sierra Naturals discussion or the American Rescue Plan Act.
Why don't we just jump ahead to Sierra Naturals? And do we have anybody from Sierra Naturals coming to this meeting, or is it
Just
I
for
couldn't tell from the
deliberation and
packet a little bit.
discussion. Yeah.
Okay.
So Sierra Naturals did send an email, thanking the board and myself for allowing them to present last month. They, are interested in continuing the discussion with the board on the specific request that they outlined. And those generally fell into the line of I guess I've included twice the cover sheet. That's why.
Right, that's why I wasn't sure if somebody from Sierra would be.
No, I think I forgot to take out page 189. Their interests were specifically around discounting.
Yeah. Packaging,
labeling, and some of what they feel were duplicative elements of our NEDM regulation, which essentially says everything you send to the state, send it to us too. That applies to things like financial reports. It also applies to background checks and that sort of thing.
Query checks. Yeah. The other thing that came up in the last meeting, which I'm not sure it was specifically mentioned, was changing the customers' access to, right now it's by appointment only.
So that's not in the Board of Health operating permit. It is in the planning board special permit for the business itself.
Okay.
So to change that, they would need a revision to the planning board permit.
Okay. Okay, so they would need to go to the planning board about that.
Yes.
That's completely out of our hands. Okay.
I mean, I think if the board had major concerns about that, the planning board would be happy to hear them. For myself, I don't think there has ever been a traffic issue there. We can talk more with the police department, but I don't think there ever has been. Given the size of the building and the fact that it's not recreational, I don't see it's hard for me to envision a scenario where you have 100-person deep lines like you might have in some recreational locations, like at the Brookline dispensary on Route 9. So it's hard for me to see how this would be a major traffic disruption, but it's not our call.
Christina and I are going on a visit next week to Sarah.
Great.
This is part of our review.
The one thing I didn't hear them mention in their presentation, but is noted in this letter, is this piece about promotional gifts and materials with reference to marijuana, including their logo. And they didn't actually talk about that, but in this letter, they very clearly outlined that they want to make an edit to that part of the reg that states that, a medical dispensary cannot offer promotional gifts or items that have references to marijuana or include their logo. And so that to me started to sound a little bit more like, getting into some advertising and promotion that I don't really want to do. And I wanted to hear what others' thoughts on that are,
I think the origin of that, Christina, was tobacco regulations.
Yeah.
And so some of the promotional items that tobacco manufacturers would give out. And so Cheryl Savara from the Mass Association of Health Boards, DJ Wilson from the Mass Municipal Association, in their work with local boards on tobacco regulations, identified that as sort of one way that marketing to youth occurred. And so they recommended for tobacco that type of requirement be in there. I think it speaks to potentially the difference maybe between recreational marijuana and medical marijuana and where the distinction would be. Because medical marijuana is not a perfect comparison to tobacco. Although there may be value in having a restriction on promotional items. I'm not sure.
Yeah, I mean, I think if you look at our numbers, for at the high school, for marijuana use, it's pretty alarming. Let me see what I just wrote it yet. So 15% of females and 24% of males consider, currently using. It goes from 9th grade at 5% to 12th grade, 36% are currently using. And 46% of 12th graders say they've attended a party with marijuana. So it is becoming so normalized in our community that I do worry about, seeing these logos and items. There was this study that I found by Rand that, said viewing more medical marijuana ads is linked to higher marijuana use among adolescents, that it does have some impact. It was in California. So that piece of their request, I was not supportive of. I don't know if there are any other.
I think we, as a board, have seen them traditionally as like a pharmacy. And when you go to the pharmacy to get medications, you don't have a bottle of antibiotics with all sorts of ads and flyers that come with it promoting other things. So it's, in the setting as a pharmacy, I don't see the appropriateness of that to have ads. Now, the one question I had is that, they want to say that they want to include doing business as air. I'm not sure if that includes a logo or, I mean, it's okay to say on the bottle, like where it's coming from, and that's actually helpful for providers, like where did you get your medication from if there's a problem. But it could just be, just type. It doesn't have to come with a logo. Like it can indicate that. That's one thing I just wasn't clear on. Is that just changing their name, or they want to?
I think that's where we could work to clarify, but I think partially they're looking for branding and to create, one of the things that was mentioned by Michelle and Dewan was there's no longer the full vertical integration. You can now share your product or sell your product to other dispensaries. I think in part, they might be interested in building up a brand that for certain edible products that is true across dispensaries, not just the ones that are within their sort of system.
Do we know what the labeling requirements are from the CCC? Is it similar to ours? Is ours much more stringent?
We had modeled them after the regulations when it was in the medical use of marijuana program at DPH. So I'm not sure to the extent it's changed, but that's something we could work on. We do have as one of our goals to revise or present to the board a possible revision to the medical marijuana regulations. With some staff absences and some positions still vacant, I don't know that that realistically can happen until early 2022, but that is definitely on our radar, that we do need to update that regulation.
The other thing with discounts, I mean, I asked the question in the last meeting, I mean, as a medical patient, it's already 20% cheaper than doing, trying to self-medicate through recreational products.
I don't think they had a great answer for that. Their contention was that it could still be more expensive in Needham for something identified as medicine that someone else could get for recreational use in Somerville. I think I'd love to see specific examples. And I think in the past, Tara and Diana have asked for more specific examples. And in some instances, they haven't been willing to provide that data. So it would be good to see more of that. Maybe you or Diana could follow up with.
I mean, maybe it's that they're using more of it on a more regular basis. I don't know, versus the Saturday night. I don't know.
Yeah.
Not the usage of
Right. I think that was one of their arguments, that the medical marijuana is that they have an ongoing use. So would be buying more.
Since Rob and I are going over there, if, anyone has anything particular they want us to, look into or, take note of while we're there, feel free to let us know.
So it seems that the questions they're asking, we would address when we review the regulation and update it.
Yes, I think I will probably need, the staff and I will probably need some direction from the board on whether you're open to these changes or you want to see potential language for some of these changes. So for example, if labeling is a non-starter, then we will work to give you language, but it won't necessarily involve the changes requested. But if you're open to some of these changes, we could draft in sort of two sections, either this or that, or to sort of choose from.
Is the CCC regulations, it's another question, maybe answer, allow for discounts of medical? They don't allow it for recreational, right?
That's correct. I believe.
I imagine they must, because I can't imagine Sierra. We can always be stricter than the state entity. We can't be more
Less
loose. Yeah.
Okay,
So I imagine the CCC must, but I will try to figure that out.
should see that. Yeah, just to compare the
Well, I
language.
don't have a problem with discounts if it's based on economic need, but to just, offer discounts to just anybody walking in the door, that starts to get to be more like advertising. Like the CBD store down here has a sign out front that says free samples. Like, I don't want to see that over there.
So they do already, though, have discounts in Needham for people that demonstrate financial hardship. That's there.
I don't have a problem with that.
So, yeah, my thought on discounts is if they're a pharmacy, I mean, although you can get like a good RX form to get discounts at CVS, it's not the same thing. It's not coming from a third party if you're just a pharmacy offering a discount on your meds, which doesn't happen. So, again, seeing them as a pharmacy, I'm not sure that I can support the discount idea. They had talked about veterans and seniors, and I guess if they can come up with a compelling reason why that's a good idea, we can consider that.
I think they need to be clear what they really want to do with this. I mean, it seems to me they're trying to inch themselves over to just a recreational store, and that's what their goal is.
I don't think they can.
No, not right.
Because they have 3 recreational permits already.
Yeah.
So it seems like it maybe, like you say, just kind of move themselves a little bit more in that direction.
So if
Because
it
they can't get a
changes,
permit.
they
Yeah.
could flip it. Yes, yeah.
So if I
And
could
then-
jump into real fast,
Yes, please.
Karen, Shannon has already started forming our team to relook at that. So we can also write up a document for you guys that say what the cannabis control are, what Sierra would like, and what we currently have, so we can compare and contrast. So that might be helpful to be able to see what the difference is and what we're okay with.
Yeah, that would be helpful.
That would be helpful. I mean, if they want to, just to get to the other issues too, with that, if they want to indicate that, you know, that their product is from Sierra Naturals doing business as Air, if it just says that, if they want to make that statement, so they can indicate to the patients and to the provider and to other companies that that's, or to anybody who's looking at the bottle, that's where it's coming from. I don't have an issue with that, as long as there's no logos. And then as far as doing the background checks, the Corey checks, I think they said at the last meeting that that part of it wasn't that onerous for them. And I feel that as a board, we should have the ability to review those things. I'm sure that the CCC does a great job of that, but I'm not sure that that's a privilege that we want to relinquish, because sometimes things slip through the cracks, don't get checked. And, you know, we are ultimately responsible for who's in there. So I would not want to change that unless others.
I don't see why it's that onerous. So I'm not ready to change it.
In fact, it doesn't seem onerous to either
Yeah,
body.
because you have to do it. So all you're doing is
simple.
clicking send to
Yeah.
the Native Health Department as well. It's,
You know, at the church, to give out communion, you have to have a quarter check. So, I mean, hey,
They email it to us along with their updated contact list every month, and they CC police on it. And it comes in every month, and now Diana's on that email too. So, but yeah, it's a quick attachment. Yeah.
And our turnaround has gotten better since we used to sort of work through human resources, which there's a lot of vacancies in the town. The town is quite busy hiring. So sometimes human resources was a little bogged down. We moved to a third party vendor to do those forms for us. Human resources vetted it. Human resources is the ones that actually receive the report, and they pass it along to us. So it actually has been quicker turnaround over the last year than it would have been previously. 2 years. We did that technically before COVID started.
okay. Other thoughts and comments related to Sierra? Okay, is that helpful, Tiffany, to at least to put together the document that you're going to put together?
Yeah, we definitely can.
All right, so if is Ally
So
with us?
Diana kept calling and she didn't answer, so I've been texting. I haven't heard.
Okay, well, we can still go on to the other things like the American.
We could
Rescue
always,
Act.
I don't know if she had a commitment this morning. We did run a little bit over, so.
Yes.
If the board is okay, moving on to the next one, I want to give a brief update about the American Rescue Plan Act.
Yep.
So as the board knows, the select board took as its first vote, sort of before it had more discussion and public deliberation, and voted in support of part of the Health and Human Service Department request, specifically the public health request for a public health nurse, which is funding Mary Fontaine's salary. The epidemiologist that Tiffany mentioned, we officially hired and will start in mid-November. And 2 contact tracers, which we're still waiting on the packet of applicants from HR to fill those. The town has not yet taken action on the other parts of the HHS request, which were about youth mental health and about sort of senior isolation and programming. And I think that that's one of our goals, is for that to happen relatively soon. It takes, I think the select board meeting date where they voted to approve the public health request was August 17th. And we're going to have an EPI in place, hopefully November 15th. So that is moving at the speed of government. And we won't have contact tracers probably in place till after that. So I think our hope is that the select board will take up the youth mental health and the senior isolation relatively soon, because it takes a little while for, once we get the green light, it still takes us a while to get everything set before we can begin to go. So I think that that's one of our questions. I know, Christina, you had asked for specifically the presentation last month from Sarah Shine, the Director of Youth and Family Services, about youth mental health and the impact. Although it is different, the housing complaints, there often is a mental health component to some of our housing complaints, especially some of our hoarding situations. So I do think that those are important needs. So if the board wants to continue to advocate for those, that might be helpful in trying to move that forward.
Okay.
That's good.
Even part of the youth component, which would be a temporary, 2-year clinician to sort of deal with the impact. Youth and Family Services right now has 3 vacancies. They've hired an admin that's going to start at the beginning of November. They've hired a clinician that's going to start at the beginning of November, and they're in final interviews for another clinician position. So that's positive, but
It's just filling
old positions,
Yeah.
yes.
I mean, I feel like that is such an urgent part of at this stage, almost more, I know our contact tracers are overwhelmed, but, contact tracing days after the exposure and days after the test, I feel like we were seeing the email from the high school last week was really troubling, or the week before. They had like 3 incidents, and, these kids have not been well socialized the last 3 school sessions, 3 school years. I really feel like it is such a priority, and we're seeing unrest in schools all around the country. It's really becoming a problem. And so I feel like it should be top of line.
Vandalism and partying and all the other things that are just happening
just
right here
bad
in Needham.
indicators, right?
Yeah,
That
partying.
kids are, and they're unhappy and they haven't been together for, or normally together. So anyway, I don't know what we can do to push that along. So if you have some specifics on who we should.
I think the
talk
select
to.
board has continued to discuss it, and they certainly want to have a more inclusive process that includes public discussion and public input. I think our hope is that some of the data seems to really point to this as being a real challenge, and maybe there could be quick consensus that this is a priority, and some of the funding needs to be allocated towards this purpose, I think. Not that there aren't many other priorities in the community that should get funding and support. I just think it's one of the most obvious effects of COVID is the impact on mental health in the community.
Yep.
I did want to bring Carol back for just a sec, because she had a little bit of an update related to additional mental health in the community. So it's sort of a pivot from ARPA.
Okay, start timing. I just wanted to say that my report was uploaded to the T late after Tim had sent the packet. And one of the important things to mention is that Tiffany, Karen Shannon, and myself met with Jen Pinto, who's the licensed social worker who was hired as part of the Trotman Family Foundation, the Behavioral Health Initiative at BID Needham. And Jen worked in Plymouth for many years, and she really has a handle as a former clinician and someone who has set up behavioral support through the hospital and piloted the program. So we met with her to talk to her about what our public health nurses do, what our prevention team does. And she had also met with Jessica Moss over at Aging Services. So I just wanted to let you know that we're grateful because the hospital has Jen in place, but again, paid through their foundation. And at CCIT Tuesday, and I know I'm going quickly, the officers told us that they are now working with the social worker that was hired as a BID Needham staff in the emergency department, which was one of the goals of the community health needs assessment. So that's going to make a huge difference. And Dave Forte said he has already been communicating with that social worker on different instances that have come up traditionally that the Needham police work with. The last thing I just wanted to emphasize is that Kim Kidders Montoya took a promotion, but what Dave and Deputy Chief Baker said is she is still working with them on cases, and she is also involved in the interview process. Now, I just want to remind everyone that we have always depended on the DMH funded emergency services program through Riverside. And that is still there. And we're all familiar with that, the 24/7 line, the mobile crisis, the home evaluation. And as Kim is perhaps not as available until they hire a new emergency services, Dedham, Needham police, law enforcement, social worker, we all know as HHS stakeholders and police that that type of emergency service social worker support can and is still available for Needham residents, and we know how to access that. So I just wanted to remind everyone of that. And the last thing is to thank the Needham channel publicly, particularly you, Shao, who worked really hard to put together an overview on the CCIT program that informs the community of the incredible commitment Needham has made. Sometimes took Tim a while, of course, to get the social worker and the police, but the really comprehensive overview on the 5-day training that has been created from a 2-day training for the police officers, as well as the collaboration with public health, aging services, youth and family. So any way you can share even the briefest link, I feel really proud of Needham and what Tim and the chief of police have done to maintain a commitment to expand the law enforcement response, you know, to be cognizant and learn about mental health, to keep up with what, you know, we've been doing in HHS. So I just wanted to say that, and thank you.
Thank you. Yeah, those videos were that you included, Tim, were really great and very informative.
Yeah, and I think it's work that the community really is not aware of, so I'm glad that you all made that.
So we have a couple other items on the agenda, and Ally is on if we want to tackle pesticides. If you want, we could tackle pesticides, and then I could give a couple brief updates, or
Yeah, let's do it that way.
great.
Since Ally's here.
Hello, everyone. Sorry for the delay. So in response to the comments that were made the last meeting, we've made some edits to mostly the brochure. So main edits that we did were changing the word poison to chemical. And there was some concern of listing the 3 organic landscapers in the area. So instead of that, I added a link to Sustainable Wellesley, and it brings you right to a list of organic landscapers in the area. And it's a pretty comprehensive list. That way it doesn't kind of look biased. And then there were some comments on adding more of the why on the brochure. So I added Protect Needham on the front to kind of emphasize why we want to do organic landscaping and lawn care. And then also I bolded the health effects under the Keep Your Neighbors Safe panel. And I added a picture of a child outside just to kind of emphasize that, you know, children are most affected too, and really make that stand out more. And I think those are the big edits that was made to the brochure in response. And then hopefully you're all able to see where I think Tim added all the resources that we used and all the sources where we got all of our information from. So yeah, this was the Healthy Lawns and Landscapes from, I think, 2002. So as you can see, we cut down the text a lot, just so it's not overwhelming. And then this is one of the guides that we use that we got some of our health claims from, particularly one from the PSA that talks about even a single exposure for your child can have harmful health effects. It was brought to our attention. We wanted to make sure we had all of the correct sources for every health claim that we made to make sure that, you know, we weren't exaggerating or providing inaccurate information. So that's pretty much all I had to go over.
Thank you, Ellie. I like the changes to the brochure. I think it's really helpful to have all that scientific information, all the information from professional organizations and how other towns have approached this, which obviously guided this brochure and the letter.
Mm-hmm.
I think it's really great. There were just a couple.
Sure.
Yeah, in the pesticide advisory, there are a couple of typos,
Oh, okay.
but that's just minor.
I will definitely review that and make sure that is all
You
set.
basically had to do sentences ending, looked like they ended with a period before you were ready to end.
Okay.
And actually, in the pesticide advisory, we're still using the word toxin. Can you make that chemical?
Yes. For sure.
And then Ally, I wondered if you had mentioned the Wellesley link. I wondered if Green Needham has any resources for organic lawn care on their website that we could point to.
We've checked with them. Yeah, it's Michael Gross, I
Yeah.
think his name. Yeah, so they've been kind of like reviewing what we've put out there. We've been asking them for those types of links and resources. Haven't had much feedback, so I can try again. But yeah, we were at a loss, like where do we get this overall green?
Yeah, it would be nice to use a Needham resource.
So we
Yeah.
can push for that.
Mhm.
You know.
I can reach out to him too.
Definitely.
I do think, so, you know, Ally and Tara did work with a number of folks in the town, including Ed Olson, who I would sort of say is our local expert on this. He's the superintendent of parks and forestry. He takes a lot of pride in Needham's fields. And the Conservation Commission, Deb Anderson, who's the director for the Conservation Commission. I know that Ms. Fine is very passionate about this issue, and she feels that what is present is not sufficient. I think we want to understand from the board's perspective how in-depth you want this to be. I think Ms. Fine mentioned sort of international experts and multiple working groups, and I don't know realistically if we have the bandwidth to move that forward. And if we did, I think some other priority would have to take a back seat if this is going to be a high priority that has multiple working groups with international experts. Our goal was to take something that had been done, update it and modernize it, and encourage what we think is an appropriate approach to the town to encourage people to reduce their use of chemicals where possible and to know that there are alternatives that exist. And we think that that is an ecological friendly approach, and it, is an approach that is beneficial to health and certainly not harmful to health in any way. I don't think it's as far as Ms. Fine wanted to go. Rob, you were on the call with me and some other town officials when she was bringing some of her concerns about overall how the town responds to her and her concerns. We were the only department that offered to change anything that we were doing. I just don't know realistically if we can engage in the type of process she's looking for with the current sort of level of staffing and funding we have.
I don't think it's realistic to meet her expectations fully. I think we should do the best we can with the resources we have, and just state that's it. I mean, she's not going to be happy, I know.
I do think it is a step forward. I think it's an important thing to remind Needham residents. I think this moves the needle. It's not, but it's an incremental improvement. It's not,
I
major
mean, there's
change.
so many lawn care companies around Needham now that I think that you offering advice on monitoring what your lawn care company is doing and how they're doing it is important.
Yeah.
A lot of people just, all they're interested in is that's green on it, and here's a check.
Yeah, I mean, I guess I'll go out on the limb, which I mean, we have a lot of very high risk, exposure to issues in our community. Yes, this is something that, is good to provide information to people. I don't think it's our number one priority for public health.
Yeah, the one thing she had asked for that was the collaborative process, and I wondered, I know you reached out to Green Needham. I don't know if you, and it sounds like you reached out to other town bodies. I was just curious if you did engage others who in this process at all.
I think we did. I think Ellen was looking for, or Ms. Fine was looking for experts from some of the groups that maybe she identifies with. I think we were sort of very focused, I think, locally on this is how we can approach it in the town. I think her thought is for experts from that have a particular sort of approach. I do think there were some challenges. Ms. Fine has some health issues, and there was a period where she didn't respond to multiple attempts at communication. And I think for us, that was coming sort of at the critical time of when we were trying to get things ready to present for the board to potentially have ready at the Harvest Fair. I do think that Ally made a conscious effort to really reach out to people. Again, not at maybe the scope that Ms. Fine was looking for, but definitely wasn't something the health department just did itself. We did talk to folks, we did engage with Ed Olson, Deb Anderson. Well, you know better than I, Tara.
Yeah, like that whole group, we had that initial advisory, we invited all the town departments, and Ed Olson was right on board with doing forums and demonstrations. He's done them before on organic lawn care. He would showcase like the Heights greenery area, which is all organic, and he would do a forum type thing. So he was all on board with working with us on that, on a collaborative approach. And Ellen was on that call, so she understands that too. So I can definitely keep reinvigorating that piece.
I think Ms. Fine has particular concerns about integrated pest management. And that's sort of a sensitive topic for people who are for chemically sensitive people who are very invested in this issue. Integrated pest management is actually required at public schools by state law. Our understanding, and we don't necessarily take people's word for it, we do research, is that it is a good balance. Are there some problems with it? Sure, but overall, it's an approach that tries to limit the use of chemicals where possible. It tries to clearly vet and understand which chemicals are appropriate. And it's what the town does for all sort of town areas, not just schools. It's only required at schools, but the town does it for other town buildings, like town hall, for example, the town common. I don't think that is something that's on the table. It's not my decision to change that. I'm one of the people that sits on the Integrated Pest Management Committee, but it's the superintendent of Parks and Forestry that heads that. So it's not our job to say we don't like this, it's not appropriate. We think it does a pretty good job for the town. It is the approach that lots of other institutions use.
I think this is a good step in the right direction.
Right, I mean, just even to bring it back to the town, I mean, we haven't visited this for a long time. And, you know, it's good to remind people that, you know, they don't have to have that perfect, you know, people have an idea that they have to have this perfect lawn. And that, you know, maybe they haven't even considered it can look different in any other way and take a different kind of approach. So it's good to just inform them on that. But, you know, I think we've done our due diligence on doing a really deep dive into getting properly informed about how to put this document together. Obviously, we can't send out, I mean, we've got 100 pages on our packet informing us about how we put together the brochure. But, you know, there is science not just from the United States, but, you know, some of the papers are written by international authors and some positions of some very important professional organizations in our country. So I think that we are well informed, and obviously we don't have every single piece of information on this, but I think that the majority of what's important is represented here.
Yeah, I wonder, so did you say that the last time this went out was 2012 or something?
I think, you know, 2002 was when we spearheaded again, they had the grant money to do it, and then I saw some experts in 2008, 2009, so it kind of.
Just comes and goes. I wonder if it's something, if we have the funds for that, you know, every spring, you know, we could do something like this just to remind folks, keep it on their radars.
I think we could certainly do a water bill insert,
Yeah.
so that would go to everyone. I wonder if we could include it, so it potentially is expensive to do it every year, but we could figure out how to do that. We could do a water bill insert and then maybe ask the town manager's office to include the pamphlet as part of the new resident welcome packet. But I think there's ways for us to sort of keep it in people's minds.
Yeah. Even through social media.
Yeah.
Tying it with water, drinking water is a good one. like,
Yeah.
people are concerned about residue.
Right, and even just so people understand, like, not every bit of the yard has to be grass, like perfect grass,
Right.
especially with, you know, climate change and people thinking about other things that they can use to decorate their land. You know, which, you know, if there's not as much grass, you know, that is one of the things that requires a lot of pesticides frequently applied. If you want to look quote unquote perfect. Right.
So what piece is actually going to the community? Is it just the advisory and the pamphlet, or is this, which of these documents are going out? Or just the pamphlet?
We were focusing more on the pamphlet.
On the pamphlet, okay.
We did revive the PSA, the spring alert too, just to kind of bring that up to speed. We could also do that.
The advisory would also be on the website, right?
On our website.
Yeah.
Okay.
Other comments?
No, I think it's a good job.
Yeah, thank you, Ally.
Thank you.
We really appreciate all the work you've done on this.
Two
Thanks
more
for your
brief
time.
updates, two more brief updates if I could. I did speak to Oscar Mertz from Equal Justice Needham, who was the proponent who proposed the accessory dwelling unit article for town meeting. He was one of the two residents selected to participate on the Affordable Housing Study Committee that the Planning Board is convening. The Board of Health has a seat on that. Ed is going to be the Board of Health's representative. The Council on Aging has a seat on that. Helen Gregory is going to be the Council on Aging's representative. Oscar's one of the two resident representatives. So I believe what he's going to do at town meeting, this is what he indicated to me, is he's going to amend his petition and ask that it be referred to the planning board. And that it needs to be incorporated into the study that the Affordable Housing Group is doing as one component of potentially affordable housing.
That's a good idea.
So I don't know that there is necessarily a need for the board to take a policy position. I know that, you know, the board has obviously supported affordable housing as a key component of the social determinants of health. And the Public Health Division did a lot of research on the format of accessory dwelling units and how to make them potentially as broad and helpful as possible. So I don't think anyone disagrees that it's worth re-examining them, but I don't know that there is a need for the board to sort of adopt a policy position or advocate on that issue, because it seems like the Affordable Housing Study Group, where the board will be represented, is where that work is going to continue. I think that's a positive. I did want to give you a brief update on the town budget process. We're moving forward with budget applications as part of the normal town process. We have an influx of funding, both from ARPA and from some regional grants that I'll get to in a second. So we are basically proposing a relatively level budget with some modest additional money for monthly charges and for technology. You know, a lot more people have phones and laptops for working than did pre-pandemic. So that's sort of one of our major components. We also have this year the accreditation earmark that's in the state budget, an earmark to study the kitchen at the senior center. We have a capital item that is in the works to be funded for next fiscal year to study the deck and the fitness room at the center at the Heights and see if they're configured in the right way. So there's quite a lot of money, and I generally like to ask for more, but I think we've got enough to chew right at the moment. We did get 2 grants that I had mentioned to the board. A regional COVID case investigation and contact tracing grant, Needham with the lead with Dover and Medfield as our partners. They funded us at about 50% of what we asked for. It is 2 years of funding. With the contact tracing collaborative at the state going away, we think it's a good way to get resources to help do this. If we didn't have the regional grant, we were still going to be responsible for contact tracing. The other grant is a shared services grant with a focus on environmental health. Same communities, Needham with Dover and Medfield. We got funded, again, just over 50% of what we asked for, but that is with renewal options, that has the potential to be a 12-year grant. We think for the projects, there are sort of 3 components, I guess. One is the actual work, that is the contact tracing, the environmental health inspections. Another level is the integrating with those communities and giving, you know, their departments or their boards a report on the activities in a way that is helpful so they can be informed and make decisions. And then sort of above that, there is a process to discuss whether it makes sense to expand upon the shared service arrangements, you know, and that could span the spectrum of we don't want to work together at all. We want to work together, but only when someone on the outside is giving us money. We want to work together and we're willing to reconfigure some of our budgets. You know, like you do septic, I do this, all the way to, you know, Dover and Medfield are very small and feel that they should merge together to form one small department, all the way to maybe it makes sense to create a larger regional department. DPH has indicated they would like us to engage Sherburne as well in that. DPH is strongly pushing shared services and regionalization. Regionalization is generally considered a bad word.
That comes out of the Special Legislative Commission.
Which you were on. I applied for a grant last week to the Metro West Health Foundation to give us some funding to do that facilitation process, to bring in someone to help run those meetings and
think we're just being reminded.
I'm hoping that didn't cut us off, but sorry about
It
that. It did,
It did, it cut you off. It completely went dark.
but I was really eloquent then. So I think we want to have that discussion. There are districts, Melrose, Wakefield, for example, where there is one combined professional health department that reports to 2 boards, each of which has authority within its own community to, assess fines, enact regulations.
Right.
I think the special commission in
That
many
was sort of
instances-
the vision of the special commission,
Right.
so that we don't impinge on town autonomy.
I think that's important. I think that is a really quick way to get people to object, is you're saying, that this decision-making body that is looking out for our town is going away. I think there's still a leap to try to get people to say, we're going to have a group that's not just us doing our work. I think there's value in it. I don't know what the right answer is for Needham. It's not my decision. It's a lot of people's that have to be involved, but I think it's worth a discussion.
I mean, part of what we was part of our discussion is you take a town like Dover and a town like Medfield, and environmental health, for example, suffers in those towns because if they have an inspector, it's a part-time inspector, or they contract out the services. And so if they could share, let's say Medfield hires an environmental health person and Dover hires a public health nurse, and then the nurse works in Medfield and Dover, and it's the same for environmental health. And so that's sort of how we envisioned that working, but that the local boards of health will still have autonomy within their town. Nobody's going to tell Dover, nobody from Medfield's going to tell Dover, well, we just changed the regulation, you've got to follow it. Sorry, it's not going to work.
I think that makes a ton of sense. From my perspective, I think one of the challenges is having direction. So it makes sense for Medfield to have a public health nurse and Dover to have an environmental health inspector. Who coordinates that work, I think is the challenge.
Yeah.
Medfield has a very small staff. They have an admin who's part-time, and they just hired a public health nurse full-time that's partially funded with ARPA money. Dover doesn't have any full-time staff. They have contracts, and the board actually is fairly hands-on in some things. I know I was talking to Jerry Clark this summer, and he had to go because there was a movie filming in town, and he had to go give them a presentation about Tripoli and West Nile. So I think that there are really different levels of resources, but the idea, as you said, from the special commission is that there would be a minimum standard in every community.
Right.
The state is starting to put real money behind it.
Exactly, you're seeing that.
Yeah. So we have our foot in the door. We have access to money. I hope we'll get Metro West Resources to have a discussion on whether it could expand.
And you can thank Denise Garlick for that too.
Oh, I know. Yes. So those are the sort of 2 updates I wanted to provide. So we will be bringing on the town also in the application process said it would forego the admin fee. So we'd have more grant money to do the work, but it would need the fringe benefits. And the town very generously, even though this is regional grants, said it will pick up the fringe benefits at least for the first year. So there'll be even more money to go towards the grant activities.
Okay.
So that's a positive. That is going to start moving forward, hopefully in November, mid to late November. And obviously the board will be a key component of that. So we'll keep you updated, and we'll start to fill those positions in the next coming weeks.
There are all these people out there, and we can't fill jobs. Finding people.
So we actually had, and Tiffany, jump in if you'd like, we had a very qualified crop for the epidemiologist position.
Oh, yeah, sure.
Right? It took, I think, Tara, we went out twice on environmental health, and we had one person who was very qualified that we hired. So we will have to go out again. I think in some instances that is a legitimate question, because it is getting very hard to fill some positions. That's a challenge that's facing town government, it's facing private industry. People aren't necessarily, especially at the lower end of the pay scale, willing to take the job if you're only offering $15 an hour or something.
Or college degrees and things like some sort of transitional program, Minuteman or some of these places, are getting folks
Yep.
trained and then a pipeline, I think is. I know.
Okay, thank you for those updates, Tim.
Yep.
So there's really nothing special in the upcoming town meeting that pertains to us since we're moving, since we're affordable housing, we're gonna refer to the planning board.
Yes.
That's correct. And we have no urgent funding requests other than to talk to the select board about the mental health spending, which is separate for their own discussions. Okay. We've discussed both other items. Is there anything else anybody wants to discuss?
Just one thing that somebody, this is again, I got some comments. They've been to Walpole and also Wellesley Senior Center. And in both cases, you have to show proof of vaccination and where to get in. And you have to, you can't get in unless you sign in. So it facilitates contact tracing, contact tracing, sorry.
Yep.
And our senior center is a little bit more loose on that.
Yep.
And so I explained to them that, you know, what our rationale was in terms of incident, numbers in the town and so on. They weren't too happy about that. They think it should be much more rigid.
Yes.
But I think that's, as I caught the conversation when I was coming in, I think that that's still our position.
I think it still is the board's position. I can certainly, Ed, you and I can talk to Colleen, the chair of the COA. I've definitely gotten it from both sides. I think some people upset that we're not having more in-person programs, even though a number of seniors have said they feel more comfortable doing some of the fitness programs remotely. I've definitely caught people on that side, and I've got people on the other side saying we should have masks on everyone. One or two people have said, yeah, we should have a vaccine mandate or requirement to show you're vaccinated. I think right now we're probably hewing a middle ground, but it certainly is something we should continue to assess. I think with the case level we have in the community right now, I'm feeling pretty good at, a seven something case rate, a positive testing rate at 0.7. I'm feeling good about those numbers.
Yeah.
And there no known transmission at the senior centers, right?
No transmission.
Oh,
Are
yeah.
boosters available, right?
Excuse me?
Boosters available for older adults.
Oh, you already got
right?
one.
Yeah, exactly. So
Everybody I
At
know
low
has already
risk.
gotten it or has signed up. So.
Yep. But it's important for us to keep an eye on that and
Yeah.
if the data does change, to be able to make a policy change.
All right. Motion to adjourn?
Make a motion to adjourn.
Second.
All in favor?
Aye.
Aye, unanimous.
Thank you.
We're done. Thank you, everybody.